Now, Gauteng, Free State, and the Eastern Cape are currently in the midst of a third coronavirus wave. The rest of the country is also showing steady increases in COVID-19 daily infection cases. The Health Minister, Dr. Zweli Mkhize, pointing out that as the numbers increase, so will the likelihood of additional restrictions. Professor Adrian Puren from the National Institute of Communicable Diseases is joining us now to talk about this increase in numbers. Prof, good afternoon. Thank you for your patience and thank you very much for your time. Welcome to the Midday View on eNCA. How fast are the numbers growing? Are we seeing surges and spikes? Are we dealing with cluster outbreaks?
Thank you, Dan. Yes, so Dan, I think it depends on where you are in the country. So certainly, as you know, the Northern Cape, the Free State, and of course now the Northwest and Gauteng are the provinces which have really shown the dramatic increases. In fact, as you know, the Northern Cape, Free State were really essentially either in the third wave or didn't really get out of the second wave in the case of the Free State. I think the Northwest, is just about there with regard to the third wave, and so is Gauteng. So we're seeing different patterns in the country, whereas, you know, if you contrast that to when we think about Eastern Cape and KwaZulu-Natal, those are really different this time around compared to what we saw in the second wave. But you're quite right. I think the case numbers are certainly ascribed to all those particular things, you know, cluster outbreaks, congregant events, all these have been reported. And so I think we're starting to see, at least in those particular four provinces where we're close to or in the third wave, those particular events contributing to the high levels of transmission.
Do you have an idea currently how long this increase could last as we're heading into winter? It's getting chillier and chillier every morning.
Yes, certainly. So I think it will vary depending on the provinces. You know, the initial modelling did not prescribe a particular time. So I think over the next month or so, we'll certainly see everybody, or pretty close to next month, being in a so-called third wave. The duration of those particular waves, I think, will really be dependent on how we manage our case numbers again. Obviously, we're not able to really stave off this third wave approaching us, but I think there still needs to be efforts put into trying to stave off the wave as much as possible. So, but that can last another 2 to 3 months to reach the actual peak and then declines.
That's quite a number of weeks, yeah. That's a quite number of weeks. And I wonder how severe it could become. Just a couple of days ago, Prof, I was interviewing the MEC for Health of the Free State, Mrs. Tsiwu, and who was really concerned how people are behaving, people not wearing masks, and people attending gatherings, and all sorts of things. And the message is being repeated all the time that even if we're getting vaccinated, we must continue observing those basic non-pharmaceutical measures.
Absolutely. So I think if we're being complacent, I think we need to reiterate those messages. The vaccine program is just really rolled off now. So it's really
are we doing a good enough job of reiterating those messages, considering what we are observing? And the MEC for Health saying she's noticed people not wearing masks anymore. The Premier of Gauteng, David Makura, last week passionately saying he's noticed that there's more than the required number of people attending some funerals in Soweto. He mentioned that as an example, for instance.
Yeah, so really, those risk communication programs really need to be, be out there to really try and encourage people. I think it's really difficult. It has always been difficult for us to achieve high levels of compliance with the non-pharmaceutical interventions, but I think we really need to continue that, try and find creative ways to ensure that, we are adherent to those non-pharmaceutical interventions, because that's essentially what we've always had and have. I know we've got a vaccine program that is certainly targeted at least the healthcare workers, so that I think is a good thing. But I think trying to get to that so-called community level of immunity is really going to take us some time. We've got some milestones to reach. But for now, while we are facing the third wave, it's still critical again when we think about those individuals who are in the old age group with comorbidities. We really need to still, I'm afraid, shield them as much as possible.
Yeah, I know that, I've heard that winter does not necessarily mean more of the coronavirus, because we saw what happened in our second wave. It happened in summer. So it's not a weather-dependent issue. But we're going to those weeks where people do tend to get sick with flu, and you'll just never be sure. What would the NICD's advice be to the general public at this time as we head into the cold months of the year?
Yeah, you're quite right. So, even though it may not always be dependent on it, it's dependent on people congregating with each other. And flu is really great in terms of transmission, and children as well in terms of flu, influenza. So again, our advice, I think, would be really to try and avoid those congregant events as far as possible. Within homes, again, look at ventilation. In businesses, look at ventilation. And again, I know that South Africa has invested in terms of the vaccines for influenza, maybe not to the same extent. But again, I really would encourage healthcare workers to start off with, should really be accessing the influenza vaccine, as well as the high-risk groups that the NICD has, and I'm sure many medical practitioners have identified as being important, such as pregnant women, people with cardiac and hypertension, particular age groups, again, really to try and access vaccines to really try and not have that combination of influenza and COVID-19. But we may well, again, I know that there are certainly cases being observed, but maybe we'll be able to escape another flu epidemic in South Africa, or outbreak, rather.
Yeah, Prof, currently on our screen at the bottom, we were telling our viewers that 3 provinces are experiencing a third wave. But when we started this interview, you actually, if I recall, you mentioned 4 provinces. You mentioned Northern Cape, Free State, Northwest, and Gauteng. So is it 4 provinces currently in the country already in the third wave, or not?
No. So I think that for all intents and purposes, Gauteng and I think Northwest have probably reached that critical, if you like, incidence in terms of the numbers per 100,000 to really be in SA being in the third wave. But I'm sure that those provinces, I know that Gauteng was already declared, but I think it's pretty close to being in the third wave. And I think Northwest, for all intents and purposes, if I look at the figures from today in terms of the incidence, essentially has reached that particular threshold to be in the third wave. But I'm sure that declaration will come along fairly soon. But overall in the country, we are certainly seeing increases in cases. But still, when you look at KwaZulu-Natal, Eastern Cape, not to the same extent in terms of the incidence.
So how many provinces, so to speak, I don't know if that's the right term to use, are officially in the third wave? I know there's nothing like that, but you know what I'm trying to get to.
Absolutely. So I think for all intents and purposes, the Free State was in the second wave, came out and went back straight into a third wave. I think Northern Cape as well, I think, is in SE, has gone into its third wave. Gauteng is pretty close to, if not in its third wave. As you know, it was already declared by the province premier, and as well as the Northwest. When I look at the data today, we're pretty close to the threshold, so that will probably enter into the third wave. But we certainly are seeing increase in cases. We're seeing increases in admissions in those 4 provinces, hospital admissions. We're also seeing, in terms of ICU utilization, oxygen utilization, increases already in those particular provinces. So again, readiness is really going to be critical for all those particular provinces, and provinces that are not near its particular threshold, readiness in terms of hospital admissions, ICUs, readiness, bed readiness, oxygen readiness. These are all going to really be critical now as we approach those critical milestones in terms of all thresholds to be declared a third wave.
In those 4 provinces. Thank you very much for clarifying that, Professor Adrian Puren from the National Institute of Communicable Diseases. The numbers do not lie, as they say. He's mentioned those 4 provinces that have approached that critical third wave threshold in terms of numbers. And we're seeing, he said, admissions in hospital admissions going up. So there's concerns about capacity. So make sure we're ready. You're talking about the Free State, the Northern Cape, Northwest, and Gauteng. 4 provinces now in the third wave, and the numbers are growing. Please stay safe. Observe those COVID-19 restrictions. Don't go to any gathering if you don't have to, and please respect the COVID-19 gathering restrictions. Otherwise, as Dr. Mkhize has said, if this trend continues, they might tighten the restrictions further.